All right, good morning, everybody. My name is Trinity Thompson, and I am hosting today's episode of Black Mental Health Matters. And today we are talking about updated and new healthcare policies and crisis resources. And I am here today with my esteemed guest host, Sonia Hart, representing from Barbados. Sonia, do you want to introduce yourself really quick for some of our new
Sure.
viewers?
Good morning, everyone. I am from Barbados and I'm a licensed spiritual practitioner with Centers for Spiritual Living, Colorado.
All right, perfect. So, with today's episode being about new healthcare policies and crisis resources, we will be talking a little bit about different policies that have been set in place both in the United States and also in Barbados, and hoping that we can open up a conversation about kind of policies across the African diaspora. Even though we don't know the exact policies or specific policies that might be set in place across our different countries of in which where we live, but we can at least start to open up the conversation and see maybe some of the similarities between the U.S. and Barbados, and maybe some of the similarities and the differences across the populations that we serve. So before I get into the policies I actually did a little bit of research on, I want to know, Sonia, what kind of policies do you put in place, or do you have any policies that you put in place for some of the clients that you serve? And like any of your own specific, not maybe like government regulated, but is there anything that you do or that you set in place like with the clients that you work with?
My policies as a licensed spiritual practitioner are governed by Centers for Spiritual Living.
Okay.
And there are two areas of that policy that I guess with any other counseling profession that comes into place, we ask that one, we be confidential.
Hmm.
And two, if we come across situations that are not within our zone, areas that we cannot really treat to, that we do referrals. That's is CSL's policy as far as me being a practitioner and dealing with clients. If I can't, and I know that I'm not qualified to handle their particular situation, especially if it comes down to a mental health issue, that I do the referral. Here in Barbados, we do have the Mental Health Act of 19, I think it's 1998. I stand corrected on that. That governs how patients are treated within our mental health care system.
Hmm. Okay. Yeah, definitely. And I think that that's something that I feel in my personal experience and also seeing other experiences, therapists or people that are healthcare providers, be in the spiritual realm, psychiatric, whatever have you. I have seen providers that do have a hard time turning down patients that may not fit their area of expertise. So maybe a patient that is suffering from a more severe mood disorder than like depression, anxiety, maybe something like bipolar disorder, where they think that they can like try and treat that with the same tactics as treating depression, anxiety, but in reality, they don't want to admit to themselves and the client that they don't have that kind of level of expertise, and they have a hard time passing up the client when in reality it's only the client that's suffering because they're not receiving the adequate treatment. But on the other hand, I've also seen in my experience people or providers that do pass up clients that they know that they will not be able to treat, and they do refer them to some of their colleagues that may have more knowledge in the field of whatever the client is trying to um, work through. So I've seen a little bit on both ends of the spectrum. So I definitely commend you for knowing, your limits and your boundaries as far as what you feel comfortable going ahead and practicing and working for with the client versus saying, you know what, we can stop right here. And I can pass you, I'd feel more comfortable passing you along to somebody that has more knowledge in this field than I do. Because I think that sometimes like people's pride gets in the way and they don't really want to pass up the opportunity to have a client because, it means more money. But, in reality, like I said, it only hurts the patient. And I think as far as my
Yeah,
experience,
and that's the thing.
Mhm. Go ahead.
I think the financials is an issue, and I know that sometimes in the care that you want to give the best possible care. And if you're really concerned about the well-being of the person who sits before you, you will make that judgment call and say, you know what, I am a licensed spiritual practitioner. I'm
Mhm.
not a psychiatrist. This person needs to see a psychiatrist because there is that difference between psychology and psychiatry. Because if
Right.
you're chemical imbalance, I cannot treat you for that. I'm not licensed to dish out medication.
Mhm.
And I'm not licensed to cross into the medical area in terms of the biological function of the brain and what's going on.
Mhm.
I can speak to the emotional and the spiritual issues that you're experiencing.
Right. And
That's
even
why
yeah, go ahead. Go ahead.
I think that's why it is necessary with the professional and even here in Barbados that there should be clearly defined guidelines for professionals who are doing mental health care at any level. There should be policies that speak to that. Yes, we do have the Mental Health Act, but that goes through the patient's rights from a legal perspective.
Mhm.
The caregivers deals with the caregivers and then with the profession, and in some cases, what the court can do in some situations. But I think that those persons who are working to assist in helping others to become better should also have governing policies as to what we can and cannot do in certain situations.
Right. Exactly. I think that from my experience as working as a psychiatric technician in a psychiatric inpatient hospital, one of the things that we pride ourselves on is patients' rights and advocacy. So one of the things that we do when we first admit a patient as psychiatric technicians, we have a booklet that has information about the hospital, information about advance directives. And if you don't know what advance directives are for our viewers, advance directives basically covers information about power of attorneys and conservators and things of this sort. So people that can make decisions for you in the event that you are incapacitated, or you're just not able to, you're not coherent enough to make decisions for yourself. So we have a guide that kind of helps patients make or just it just gives information about those things, especially beginner information if you've never heard of that stuff before. And we just want to make sure that our patients know what their rights are as far as them being a patient in our you on our unit, and rights versus being signed in voluntarily or being signed in involuntarily. So they're on a physician's emergency certificate where are be they are being held there against their will, but they need to be medicated and treated. And we definitely work our hardest to encourage patients to definitely use our patients advocacy line if they feel that they are being mistreated in any way, or if they feel like their voice by themselves is not being heard. And we have people to step in and kind of help the patient advocate for themselves in the event that they are not able to. So I definitely think that that's something that could be, if it's not in all hospitals, it definitely should be more of like a policy and regulate or regulated policy. And do you guys like do you know if there's anything like that in Barbados, like as far as like the hospitals are concerned? Like if they
I
encourage
am not sure of what happens within the hospital, but I know that our mental health speak to a lot of those issues that you just spoke about.
Mhm.
But I am not sure that the hospitals here, we have one major hospital and
Okay.
then we have a few private hospitals. But I'm not sure what the hospital policies are in
Okay.
terms of the admittance of persons with mental health issues. I know that we have a psychiatric hospital which is separate from the major general hospital.
Mhm.
However, the general hospital also has psychiatric wards on it. So there
Okay.
was where if you go in, but I do not work in that area, so I really can't speak to all of what happens in that area.
Right.
I just know the
Right.
Mental Health Act covers persons with mental health issues and how the caregivers are dealt with and stuff like that in those situations. But I can't speak a lot on that because I'm not in that area.
Right. Okay. There's definitely no problem. I just know that from in the US, a lot of hospitals, especially psychiatric hospitals, or which historically have been called, psych wards or like mental asylums, they kind of get a bad rep, especially to this very day of patients not being just patients kind of like being tricked by doctors and healthcare workers and not being able to express their own rights and their own autonomy as far as making decisions about their own individualized healthcare plans. When in reality, that's not the case. Especially at the hospital that I work at, patients have a very fine set of rights, especially being admitted into an inpatient unit, and we definitely strive to make sure that the patient knows that at all times, that especially if they are signed in voluntarily, that they can do things like sign a 3-day letter and if they want to leave. But unfortunately, that's not the case if you're signed in involuntarily. But all patients have rights, regardless of the status that you're in. Patients have the right to I'm blanking on the terms, but basically, patients have the right to be just lost it again. Be treated with dignity. So, whatever the case is that you are in, um, be it if you are incoherent versus coherent, if you are in the middle of a psychotic episode, all patients have the right to being treated with dignity. So that means if you're not able to care for yourself, we step in as staff and we help take care of you. We don't let you just sit there and soil yourself and bang your head against the wall until you kind of come out of this psychotic break. We actually go in and like take care of you because as a patient, you have the right to dignity. So just respecting like basic human rights and then going above and beyond. So I
So
see that. Go ahead.
that calls for a level of training
Hmm.
um, that I cannot even speak to because I don't know what training our psychiatric nurses go through to deal with those things. I know I've heard complaints from people, even in the general hospital, that some people, some caregivers, are not suitable for the position in terms of the manner in which they treat customers. But we still must realize that people show up as who they are. And because I'm a caregiver doesn't mean that I'm going to be compassionate. I might be carrying my own demons within me and just transfer that into the kind of care that I'm given. And I remember this incident in the general hospital with my aunt. She had a rash on her skin, and I remember in the ER and the nurse said, I'm not touching her because I don't know what she has.
Right.
And I was pissed. I was pissed because how is it you signed up to be a caregiver and you're going to be scornful with someone in your care, Because
Hmm.
my thing is, you put on your gloves, you do what you have to do. That was my thinking. You put
If
on your
you are
gloves and you
a
do what you have
caregiver,
to
you're
do.
supposed to give care. It's kind of in the title.
Yes. So for me, I think that healthcare policy should speak to these things. And I know for me as a spiritual practitioner, there are codes and ethics and policies that I must observe in order to maintain my license.
Mm-hmm.
And I think that the same should be for any other healthcare provider within the policies of either the institution or at the national level. That policies should speak to the codes of ethics that you're going to bring to the job and the policies and procedures, so that you don't just have license forever, but you have to go before a review board maybe every 3 years, 2 years, however, and that certain practices are always being practiced by the individual in terms of the care that they're delivering. And the reason I say this is that we impact the well-being of others at a spiritual level and a mental level based on how we treat them. People remember, I didn't like that experience, and some people will carry it forever and ever, and therefore you have the issue being repeated over and over, because then they suffer from depression or whatever, and that feeling of I wasn't cared for properly, people don't care about me, and that impacts on you. So healthcare policy should not just address the patient, but also the caregiver.
And you know what? We've definitely have had conversations about that within my own staff, because especially working in a psychiatric facility, it's very easy to get burnt out. And I feel like I've reached a point of burnout before. It's even, I think burnouts can even occur within just a few days, especially with working at a psychiatric facility. We are a place that is open 24 hours a day, 365 days a year. We don't ever close because we are a hospital and we serve people that are in need of help at all times. It does not stop. So we have staff that do double shifts, that's 16 hours. They turn around and go home, maybe get a few hours of sleep, get some food for 8 hours. That's really not enough time to get a full decent time, like a full decent amount of sleep, and like get some food to eat and take care of yourself, and then turn around and go back to work for another 16 hours. So the mental health state that you are in definitely can affect the level of care that you can provide to other people. And we definitely work, I feel like at our hospital, the Institute of Living in Hartford, Connecticut, we definitely work to make sure that we support each other as staff, to make sure that the patient is not being abused or neglected in any way because of your own mental health and your own sanity. And I definitely think that that's definitely a good point, to make sure that there's somewhere in within like the policies and the regulations that we have as caregivers, to make sure that we take care of ourselves first, because we can't take care of other people if we don't take care of ourselves. So I'm really glad that you brought that up. So I want to move into the first act that I did a little bit of research on, and I recognize that you are from Barbados, you are not from the United States. But I'm hoping that maybe you can just share a little bit about maybe some similarities that you see like within your own practice, and some like maybe some of the populations that you serve, and maybe if there are questions that you have for me within like my own experience working in a hospital in the US, a psychiatric hospital in the US. So the first thing that I wanted to talk about is the Low Healthcare Costs Act, which was passed in 2019. And before we got on here, we talked a little bit about Barbados and like their timeline of updating laws and acts and policies. So the Lower Healthcare Costs Act, for our participants that live in the U.S. and even just across the world, it was an act, sorry, that was enacted in July 2019, and basically it talks about working to provide financial relief with lower costs for things like visits, prescriptions, diagnostic testing, screens, things of the sort for patients. And families that are just seeking healthcare services. So with this act, I definitely feel as though in the United States, healthcare is one of like our billion-dollar industries. You know, our economy wouldn't be where it is now without healthcare, and because of that, you know, healthcare costs they skyrocket. We pay a lot of money for things that should be like in my personal opinion, things that should be as low cost or free of cost in general. Things like prescriptions, things that people need. I don't think that necessarily we should be trying to capitalize on it. But in Barbados, tell me, Sonia, if what how like what kind of significance do you think like the healthcare and like the insurance and things like that how significant is that in like your country's economy?
Repeat the question. You dropped out for
Okay,
a moment.
so yeah, so how significant of a role does healthcare and insurance play in the economy of Barbados? Like, does it play like a significant part? Is that like something that like brings in a lot of money to the Barbados economy, or is it like some other things like leisure and like travel and like tourists and things?
Hmm. Now, you know, that's a good question. And you've asked me a question about insurance. And I know that we do have health insurance here.
Mm,
Some people do pay health insurance. But because of the way our healthcare is structured, especially if you go to a public institution where there are, and I would say no cost to the patient up front, there's no cost to the patient up front. I think we're in a fairly good position to say that we do not push health as a income generating aspect of our economy.
mm-hmm.
I think I can safely say that, unless it is health tourism.
Okay.
Yeah, unless it is health tourism where people are coming from abroad to, and not even to our hospitals, but to have some sort of health care.
Mm,
But outside of that, I don't know that we look towards our healthcare as generating billions of dollars for our economy.
okay.
Because yeah, for most people, healthcare is either, and I'm going to use the word free, not that it is free because I believe that every taxpayer contributes to that, but the minimum, you don't pay a lot for it.
Okay.
However, if you go to the general hospital as a private patient, then you pay some fees. You'll have a few fees, and it's not as expensive as in the USA. Healthcare in Barbados is not, because a lot of it is heavily subsidized. Persons who are pensioners, for example, how their medication subsidized. What they may pay is the handling fee at the drugstore, but outside of that, a lot of medications are free of cost.
Okay. I think that like what we have here is like an interesting like dynamic because like in the US where black people are not the majority. We are not the majority of the population versus Barbados, which is. So I think that like it creates like an interesting like different type like you're giving me like a different type of perspective, which I appreciate. Where it's hard because in the US we definitely have a lot of communities of color and black communities that make up the lower portion of our the just overall socioeconomic status. And things like healthcare aren't as easily accessible. Healthcare and insurance aren't as easily accessible, be it quality healthcare providers in these types of neighborhoods. Um, Insurance is very expensive. Insurance gets taken out of our paychecks, or like you pay for it like on your own. But like yeah, insurance gets taken out of your paychecks, and then like you can select how good of insurance you want. Like if you want like basic, like just covers like the absolute bare minimum, versus if you want everything covered, like mental health and vision and dental, and things like that. So it's like what you're telling me about Barbados and how it the healthcare and like the insurance industry is it's not like one of the top. money generators for your country is definitely a new perspective. Is something like I'm not used to, because here in the States, like we pay for everything. Like you go to the pharmacy, you're gonna have to pay. Medication can be very expensive. This is the part of the reason why like a lot of our people, like a lot of Black people here, like the stigmas of mental health continue to be perpetuated, is because a lot of people can't afford being able to go and receive help like that they need. Like a lot of our services are very expensive, like thousands of dollars expensive. And if the insurance doesn't cover that, then it's just like we're kind of like flat out of luck. Versus people that do. And I'm not saying that we don't have people that can afford it, because we do. But one of the things that like I strive to do is I wanted to help eliminate or at least reduce stigmas as far as like seeking mental health care. But one of those stigmas of unfortunately is the cost, and people not being able to like pay for the cost. And I think that like this type of act definitely is something that can help people, not just here, but just people across like our diaspora, to be able to afford to be able to go to the doctor. Like it might not be like a as much of an issue like paying for it like as it is in Barbados, but I know definitely here it is one of the reasons why people don't go to seek help, is because when they are here, I see patients all the time. They're just like, I don't need to be here. Like I got to get home. I got to have a job to work. I can't afford to be here. Versus people that simply cannot afford the cost. They don't have insurance to cover their stay in our hospital. They don't have insurance to keep up and like maintain their medications after they get discharged. So I think definitely the Lower Healthcare Costs Act is something that marginalized communities could definitely benefit from. I don't know. Do you have anything else like you want to add about like financial? I don't know. Like, are there like other like financial relief programs in Barbados, or just like how about like you talk about like some of the like the clients that you see? Like, has anybody ever like expressed to you like they don't know if they can afford the cost, or like are your services affordable to your clients? If that's not too personal.
I tend to work with clients where they're at. And some of my clients will pay upfront, and there are others who will say, well, I'm having this issue, but I can't afford this.
Mhm.
And I try not to turn people away because of money. I'm here to help people to return to that wholeness. Sometimes you just have to work with people where they are. And for me, having a world that works for everyone is very, very important. I'm not
Mhm.
saying that a patient shouldn't pay, because I encourage payment of some form. However, should a practitioner, should a healthcare worker turn someone away because they don't have the resources? If
Right.
I know that they can get the same resource at the polyclinic or somewhere else, I might just do a one-off with them and then refer them, go see so and so at this place, because there you can get that benefit
Mhm.
without having to put out a whole lot of money.
Exactly. We do have,
Healthcare in any area is costly.
yeah, especially for private businesses. We do have a comment. Ty M says, right, the healthcare system in the US is treated as a business, so they're looking to generate income, which is why I said, Sonia, that like here in the US, it's a $1 billion industry. We make a lot of money off of what we call big pharma, which is like just pharmaceuticals. Like that's just pharmacy alone, being able to get your prescription. We have people that go into private sectors and private businesses to practice on their own. And as a person that is looking to open a practice in the future, I personally feel as though I did go to school, and I do want to be able to make the money back and provide like a good lifestyle for myself. But I also believe in not just turning down a client because they can't afford it. Like I've been in a situation um, in therapy where my provider has charged me for like appointments that I missed, or just like my co-pays with my insurance would like change almost every time, or changed a few different times, especially with my psychiatrist as well. And it was really hard to keep up with at one point. And I thought about leaving and just probably doing my own thing, or just kind of using some of the coping mechanisms that I had already learned previously within like our sessions, because it was a real hassle to get back and forth and to be able to keep up with paying for those appointments. And I was in college at the time, so I did not like have a steady job to continue paying for prescriptions and paying for my visits. So I do have a level of empathy for people that, for providers that know that it costs to run a business, yes, and the cost is obviously going to have to come from the client. But at the same time, I I feel as though like I do share very similar beliefs with you that clients like it, I don't know, like I wouldn't want to turn somebody away because of what they can afford versus what they can't afford. Like I feel like maybe down the line, like, it's just something that could be figured out. Um, but as far as them being treated, like who else is going to treat them? Because like I said, here in the United States, it's money first, services later. So that's definitely something that I feel like I look forward to changing. Another act that I found was the mental health.
I take a very holistic.
Mhm.
I was going to say that I take a very holistic approach to mental health care, and the money. Yes, it is important because there is that cost of living that practitioners and other healthcare workers have to undertake.
Mhm.
However, sometimes you must make a judgment call and say, you know what, I'm going to structure my pricing in such a way that even if I have to take in one or two clients who are not paying, my structure allows me to cover that. My pricing structure allows me to cover that. So
Mhm.
I think in pricing, maybe we need to have a percentage and say, okay, this percentage will cover those who can't pay. And yet still you have to minimize the number of persons you see who cannot pay. As I said, here in Barbados, there are clinics where people can go to. I
Mhm.
understand people don't like the stigma of walking in the gates of a mental institution,
Exactly.
but this is something that people have to understand. The mental illness is not a sin and it is not a crime. For me, I've always approached it as the same way your physical body can have an issue, your mind can have an issue.
Mhm.
That unseen part of you can have an issue. The brain can have an issue. This way, you need a psychiatrist to come in.
Mhm.
Your soul can have an issue. So, just as all these things have, little deformities going on, for want of a better word, and you can go to a doctor for the physical, go see someone, and don't be ashamed about it. And I think that's one of the things that we need to speak to. People should not be made to feel ashamed because they're not feeling okay at the mental, emotional, spiritual level.
Right. And you know what? That definitely I was gonna talk about the Students Act. But you said something that reminded me of one of the other acts that I want to talk about that was passed here in the States is Restoring Hope for Mental Health and Wellbeing Act, and it was passed earlier this summer. And basically what this act covers is more access to substance use disorder prevention and treatment programs. And but the part that it made me think about was how mental health care should be integrated more into the primary health care visits and things like that. So I know here in the States, when people go see their regular doctor, their physician, they there's like a very small portion of your visit, like it could be like your annual checkup, where your doctor might give you like a questionnaire, or they will ask you the questions themselves about how you're feeling mentally. And usually those questions are like, are you depressed? Or like, do you feel tired or sad most days? Have you ever felt suicidal? Have you ever acted on those suicidal feelings? Or have you ever attempted suicide? And usually, those it's just about like maybe 5 or 6 questions, and they get. I feel like it kind of gets swept under the rug because if you don't like score high enough to like where like your answers are kind of alarming, it gets swept under the rug, and then your doctor never asks about like that again, and probably until your next visit. When in reality, you could be lying on that questionnaire because of stigmas, um, or your answers are just not as alarming as they as it would be to be like, okay, I'm looking at this questionnaire. You said yes, you've attempted suicide. Um, Now you had to go to the emergency room. So I've always felt like there should be some type of policy put in place where there should be some sort of mental health um, portion dedicated to your primary care visits. Like I feel like physicians, primary care providers should work very closely with mental health care providers because like you said earlier, I was now bringing it back to your comment was just like something in our body can be sick, our minds can get sick as well. And and I feel like mental disorders and your body, like the things that can happen in your body, like disorders, can be very comorbid. So it's like you can be depressed, and you can start overeating, you can start undereating, you start developing eating disorders, you can develop type 2 diabetes. You're just not taking care of yourself. So I think that that's what you that is sorry, I was looking at a comment. I lost you guys for more than 10 minutes due to internet issues. No, Saba, we did not answer your question yet, but we will get to it. Um, but no, I
I
was
just
saying,
want to say that until
mm,
we start to look at health in a very holistic way, mind, body, and soul,
mm,
we're going to continue to see lots of issues because we're not bringing balance, and we have to bring balance into the mental into healthcare. In other words, when you go to see your GP, and this was covered in last week's session, where the question was, should GPs be doing more work with the patients, getting into the mental aspect first, where
mm,
are you? How are you feeling? I don't want to hear about your pain here, your pain there first, because in some cases, we have what is known as that psychosomatic
mm,
behavior pattern going on within the body because there's something wrong with the mind, and the mind is sending signals to the body that something is wrong, and they have all this trapped energy in different areas that sometimes if you release it at the psychological level, then you find you don't need the medications, you don't need to be hospitalized because the psychological aspect of that problem has been taken care of. And when you start to think differently about yourself, your health changes. You become, for want of a better word, better energized. And that's what we're working with primarily, the energy within the body system,
yeah,
the spiritual thing that keeps us going. And once you can make that healthy, then everything tends to work better for you. And I'm sure that all of us here have heard of miraculous healings from terminal illness just by people changing their perspective of that illness.
mm,
So, mental health and physical health, they're all linked together with your spiritual health. And that's why I encourage people to look deeply at their spiritual practices, at their belief system, what's going on within your mind first.
yeah. I definitely agree with that because I know like one of the common issues like in the Black community is as far as like within your body is like high blood pressure. It's very prevalent within Black Americans. And some of the physical symptoms of high blood pressure could be like headaches or just things like that. And without So your doctor will try and treat the headaches and the high blood pressure with prescribing you high blood pressure medication and say, oh, take maybe ibuprofen or Tylenol for your headache. But in reality, you probably have a headache and high blood pressure because you're stressed, and you're not really and the your primary care provider is not acknowledging the stress portion of it. Why are you stressed? You know, you're going through like a lot of life changes. Say you're a mid-aged adult, your parents are getting sick, maybe passing away, you're in between jobs, you have kids, things of the sort. Maybe you have traumas that weren't addressed from when you were younger. And the reality is that maybe a lot of those things could be not solved but treated. Would you would probably benefit more from being treated with a mental health care provider, somebody that can sit and talk with you. And maybe I'm not saying that this is the only right answer, but maybe you will start to see some of your symptoms be alleviated once you start going and sitting down and talking with somebody and having somebody, check in with you every so often, and somebody that can help you manage your stress instead of slapping a band-aid on the physical symptoms, because they're not going to go away if you don't ever address what's like keeping your mind fogged up.
I'm going to share this with you because eating disorders create diabetes and the high blood pressure issues. And I remember when my sister committed suicide back in the early 80s, mid 80s. I moved from 190 pounds in a few months to 180 pounds because I ate consistently. I never mourned my sister's death until 2 years ago, maybe less than 2 years ago, when I was doing my studies to become a practitioner. But I ate to, just soothe my own inner pain, to deal with my demons. I just ate. So sometimes the disorders physical disorders that we see are really linked to emotional and mental disorders. And if anyone had told me that I had a mental health issue back then, I would have disagreed terribly with them. I was like, no way, I'm fine, because I felt that I was that woman who was so strong that I could deal with anything. But for me, it showed up by my eating patterns. And over the years, I continued to just have that bad eating habit until I became diabetic.
Yeah.
So our emotions play I'm using the word emotion, but our mental health can show up as physical illness as well.
Definitely.
Everything is linked. Everything is connected.
Mm-hmm.
So do we need a reform in terms of our policies? I think policies should be holistic, that it should cover all aspects of health so that it leads to better mental health. Better mental health leads to better productivity within the community, within jobs and everything like that.
Yeah, it definitely should be integrated more within like your primary care, just like to wrap that up. I definitely agree. I don't like the way that it's separated, kind of like how here in the States, dental is separated from like your regular medical insurance. And I don't understand that because your teeth are in your mouth is on your body. So how is that not medical? The same way, your head, your brain, everything like that type of stuff it's literally connected to your body. So I'm not understanding why before this there weren't many policies.
I would like to answer,
please. Yeah.
I would like to answer that for you, but then it would take me into the realm of theology where we speak of oneness. And until we get to that place where we recognize that there's only one, our bodies are one body, not 10 different bodies, and everything is about unity, then you will always have this separatedness going on. And a lot of it is out of our theologies, how we've been socialized to think of things in duality and separation.
Yeah.
But if we came back to that place where it is about oneness, it's one body, everything is connected, everything operates under one system. There's one life force that energizes the entire body. If you can bring it to that, and again, I'll come back to being holistic, if you can bring it to that, then we can create the healing that's not just for persons with mental health issues, but persons with any other kind of disorder. There's some
Right.
questions that I think we should answer, like Ty is
Mm-hmm.
asking about the perspectives of an individual that would prefer a spiritual practitioner versus movement. Well, what I want to say, Ty, is that as a spiritual practitioner, my job is to return my client to wholeness, to find that place of wholeness. I'm dealing with the soul and I'm dealing with the mind. Whereas a medical doctor is going to look at the physical body, I look beyond the physical. And I'm going to use another term. I look at what is we would term the metaphysical, that which is not seen, but we know it is there.
Mm-hmm.
I hope that I've answered your question.
Yeah, and I think I mean I don't have much knowledge about a spiritual practitioner, but what I think as far what I guess if I were to see a spiritual practitioner to or if I were to integrate that a part of my mental health care plan, what it is now, I think that what I would want in a practitioner to be able to see that I probably would not get from a medical doctor here, at least in the States, is somebody that integrates my personal religious and spiritual beliefs with my mental health. So if praying and maybe journaling
That
to
is
God or
correct.
something like that is a coping mechanism for me, I would want my spiritual practitioner to help me kind of figure out how to integrate that into like my mental health care plan and to I guess help or maybe educate me a little bit more about maybe the things that like I don't know. Maybe like answer some of the questions that I probably have. Like if I was I don't know, maybe like if I started to question my religion or maybe if I started to question like my spiritual beliefs, somebody that is a little bit more experienced in within that realm could like answer for me and help me kind of like put me on like a I don't know, maybe like a new spiritual path or help me down the spiritual path that I'm already on. And you know, with doctors, I think that this also comes with cultural competency because I know as Black people, we do have a people that are spiritual and religious do integrate that component into our everyday lives and tend to rely on that, especially as a coping mechanism. You know, praying, grieving, and but feeling um, accepting grief as it comes because we know that you know it's a part of like God's plan. I don't mean to, like get religious or anything, but like I'm just speaking from my own personal perspective and on behalf of my family, I know that that's something that like we rely on. So I think that like things like that is important, and those types of aspects you can't find in a medical doctor because what they know is like kind of factual information, like things that you can get like out of a textbook, um, and they don't really consider other aspects kind of like religion. They just see like kind of like what's here, what's in front of me right now is a patient presenting with this problem and this is what I'm going to solve. They don't integrate that kind of like spiritual component versus somebody that kind of
I'm
goes
going to disagree. I'm going to disagree with you there because there are medical doctors who integrate. There is Deepak Chopra. There
Mhm.
is Melissa Rankin. I hope I got her name right. And one of her books, and I'm saying one of her books, is called Mind Over Medicine, and she wrote from her own spiritual experiences as well as a medical doctor. There are several medical doctors and scientists, people like Bruce Lipton, who have integrated science with metaphysics and quantum physics, who understand that there is within the physical form something else that keeps that form going, and who can explain it a whole lot better than I could, you know. But what I'll say is that there are some who integrate, who recognize that beyond what they know physically, there is something else at work, and there are doctors who will say, look, we've had healings that we cannot explain. You know, patient coming to see us with terminal cancer, and then they come back and they go to some shaman, go somewhere, come back and completely healed.
I
It
would
is
love to
gone.
see more of
So
those
there are
doctors. Man. I feel like
they are there,
I would feel
and
more
they are
comfortable.
there.
Yeah,
They
I
are
would.
the
I
one I'm
definitely
going to
feel
say.
like I
Yeah,
would
they
feel
are there.
a lot more comfortable, like under like with a provider that integrates like that type of experience, because I feel like that would be more assuring to me that I have somebody that can relate to me on different levels, with me as a patient and them as a provider. Kind of like having like that just more of like a more reassuring connection with that person. So I definitely think that that should, I would love to see that integrated even more. I guess I would
Yeah,
love to see
there is that, and I've known of this for quite some time, for many years. I know I have a friend in Germany who was an alternative medical practitioner who worked out of a hospital in Germany. There's a young lady who moved back to Barbados who worked also as an alternative practitioner, medical practitioner in Florida. So there are some hospitals that incorporate, the other forms of science into
more.
their science, who recognize it is all science. So
Okay.
they are there.
All
And there
right.
are hospitals who hire spiritual practitioners. They're, especially in Canada. You see these big ads come out, we're looking for a spiritual practitioner to work, and they'll list all the qualifications needed and the experience needed. And it is pretty much what you said, persons who can identify with a patient where they are in terms of that patient's understanding of God,
Okay.
help them to make sense of things from a spiritual perspective.
Yes, I definitely appreciate you disagreeing with me and offering me that new perspective. I know that, well, I shouldn't say I know. I've experienced a lot of doctors that kind of just stop at like what the medical side is. So I would definitely love to see more doctors kind of integrate, if they do, because it's definitely okay.
Yes.
With agnostic doctors. Um I personally like, I would love to see that type of care also
Yeah,
integrated.
there is that. And the thing here is to have policies that reflect, when you're creating policies must reflect that there are going to be other types of healers coming into the equation, especially now with the world moving towards, I want to say, a lot of shamanistic beliefs and practices resurging, especially for us as Black people,
Hmm.
where certain practices, especially in the Caribbean, coming out of slavery, were prohibited. Things like obey. Obey is now legal on our books, and a lot of people think that obey was something sinister, but it was just the use of herbal medicines, herbal medicines and shamanistic practices to help people to heal. But there were people who thought, oh no, this is something sinister and something outside the scope of what our religion teaches, and it was banned for several years, made illegal. So now that we have a resurgence of people going back to a lot of old traditional methods of healing, especially healings that came out of the African continent, I think that going forward, healthcare policies should include some of these older practices that are now making resurfacing.
Yes. And you know what? So for everybody out there that has Netflix, there's this really good documentary that I watched. It's called How to Change Your Mind. It's a different conversation, because then it starts going into like the legalities of like, kind of like you said, bringing back the more traditional ways of providing treatment and curing people. But it's called How to Change Your Mind, and it's about different psychedelics that people have used historically to treat mental illness, like I think I definitely know some of them were depression, anxiety, but they talked about like ketamine, they talked about LSD, different hallucinogens that people have used. But then it also kind of goes into, like I said, um, how the government has tried to control that and like make these substances kind of like illegal, like how traditional shamans like would practice. Um, but again, like that's just kind of like another conversation for
That's another conversation, yeah, because right now we're dealing with the policies, and I think we
Mhm,
have veered a little bit from policies into other things. But
mhm.
policies create that framework for all of us to work in. That is the practitioners, the healthcare practitioners, mental health care practitioners, and the clients, patients that we see. so that we have a holistic policy, a policy that incorporates what I do, what you do, and what the psychiatrists do, so that we can all collaborate in terms of helping to create a world that works for everyone.
Mm-hmm. Yeah.
Rather than I'm just in it for the money and I want to make as much money as possible. And who does Sonia Hart think she's coming in here trying to get some of this money, but collaborate. If we can collaborate as mental health care practitioners, we will see more healing taking place.
Exactly. And I think that, a lot of policies are definitely put in place with the intention to help, but there are policies that have been created to kind of oppress and to, again, that's another topic.
Yeah, and I wanted to speak also on resources, that there are resources here in Barbados, especially with the pandemic happening. Took a stand where we now have hotlines at various government agencies for people to call in to deal with their mental health issues. And there are some that are specific to the very young. I do not have those names with me at the moment, but
Okay.
Barbados has taken that stand, and I'm taking that stand to make sure that there are those hotlines in place that people can call. Whether or not people are aware and they're using them, that's another matter.
Right. And as it is here in the States, I definitely want to get to some of these questions before we end, but that is here in the States as well. I remember the suicide hotline was kind of like the only one that was like ever really talked about, but now they've created hotlines for alcohol use disorders, opioids, so it's not just like substance abuse just in one program, but they have split it up for your own to just be a little bit more specific and a little bit more inclusive, so that way it's kind of like not all substance use disorders are being like grouped into one. So I want to go back to Saba Omes. I hope I'm pronouncing your name right. Your question. And I looked at it a little bit. I'm not sure if I understand, but if you want to clear it up. Says, I want this question to be answered, and it is about being reclusive from your own toxic family after forgiving them. Is it a good practice? And even if it is not, I choose to, as I know some family issues like a conundrum. If you Saba, if you're still on, if you want to re-clarify your question, you definitely can. I'm just gonna move on to the next question. Joshua Brown says, do they have holistic professions in Barbados? If so, what is the difference between the use of a holistic profession and a spiritual practitioner?
Okay, that's a big question. That is a really big question. We do have holistic professionals in Barbados, and we have Reiki practitioners. There's Reiki, there are pranic healers, there are people who are into alternative modems of healing. The difference between the holistic practitioner and myself as a spiritual practitioner is that my job is to return people to wholeness using the teachings of Science of Mind. And that's what I use, the Science of Mind teaching, the Science of Mind philosophy, to help people return to wholeness. I deal with what's going on in your mind at a spiritual level. The other professions do some similar work, but they also do some physical body work as well.
All right. So I hope that helped answer your question, Joshua. Saba also said, I wish I could be a volunteer for spreading mental health group, as many people are silently suffering and there needs to be addressed. I want to speak on this personally. This was something that I also had issues with because I wanted to be more of a mental health advocate. And I wanted to start like creating a platform for myself, because not only am I trying to school myself with this and like get my master's degree to begin as a mental health practitioner, but I also want to figure out how, like, what are other ways that I can get involved without like actually like having a job. What are some like ways that I can volunteer? So this platform, Black Mental Health Matters, is a platform that I volunteer for. I think just going on like LinkedIn, not Job or ZipRecruiter, but different volunteer sites. But I think I want to say LinkedIn will probably be your best bet because it's a really good platform to network on and just kind of like get in touch and just like at least just start talking to people about like different ways that you can get involved and maybe use or create like your own platforms to begin advocating for mental and spreading mental health awareness, because like I said, that was me about like maybe a year 2 years ago, just wanting to like really get my foot in the door but not knowing how. So I found this opportunity on LinkedIn. I think that LinkedIn is definitely a great platform. Sonia, do you have any like resources that you would like suggest to people that would want to get like involved in like mental health?
I'm thinking, and at the moment, I would go with you. It is
LinkedIn.
LinkedIn. I've seen a few others places advertise. There is Black Mental Health. There is just mental health. You just do a search on the internet, and lots of them will just pop right back up at you, and you can investigate.
Yeah.
Investigate.
Yeah.
There are tons of them out there. Or maybe just walk into an institution and say, look, I would like to volunteer and help, and or put together your own program and say, this is what I can do where I'm at.
Yeah. I know there's for any viewers that are like near college age or in like college, definitely think about getting involved on campus. That was something that we didn't have time to touch on, but getting involved in like campus mental health organizations or even starting your own is definitely something that is like well needed going into schools. Even like volunteering with the kids after school, something that like can, I don't know, there's just so many different things like within mental health that you can do to volunteer and like show up for like other people that come up as other opportunities. You can go to like your local hospital and see like if there are any volunteer opportunities there. If you have a pet, hospitals do allow volunteer emotional pet services, for their patients. So you can definitely, take your dog or cat, given that they are like safe. And I think maybe like follow like different regulations, but given that they are safe enough to like have on to like a unit, you can always like bring your pet. And I know that's something that we do at my hospital. And yeah, just like Sonia said, just get online and start doing some research about different opportunities near you. And we definitely suggest LinkedIn. So with that being said, Ronnie Voltaire is watching live from Kampala, Uganda. Hi, Ronnie. Um, I think that's it. Do you have any parting comments, Sonia?
Yes, I would like to say that you cannot wait for a crisis to happen to talk about mental health and to get people aware. You have to speak to those persons who appear to be well, because there's a very thin line between being mentally well and being mentally unwell. And sometimes people are not aware of the symptoms that they're carrying
Yes,
for
it's a
mental health
very thin
issues.
line.
So if you can speak to people all the time, it is like when your mental health immunity starts to go, there should be symptoms that you should be able to identify. And if we can reach people before they reach that peak where they have to be institutionalized or go on medication, I think that is the way to go. Start talking about it with kids, because children do display mental health issues that we say, so he's just behaving badly. Start talking to young people who are thinking about having children, about the issues that can come up, especially with transference from one parent to another in terms of the mother's mood not being the happiest. Children can be born sad. There's so many different areas where this conversation can go so that people seek help sooner than later, or have to be forced into getting help.
Thank you. Thank you for those words. And I think as far as what I would leave this conversation with saying is If you're ever looking to get involved in like legislation, but like you also care about mental health and you want to be a mental health advocate, I definitely would start off with going to your local government and just seeing how like different ways that you can get involved, because the legislative branch in the United States is composed of the Senate and the House of Representatives. And, these are people that are here to kind of represent our thoughts at the nationwide level. So definitely getting involved in your local government, so that way these things can get passed on to like the state level and then to the national level. I'm not sure how it works in Barbados or in whatever country that you're watching from, but please definitely look into just learning a little bit more about how you can represent the things that you care about. In this case, it would be mental health, and how can you use your own platform or create a platform to spread awareness. So I would also say that to our viewer Saba. So I'm going to wrap this up. Thank you guys so much for watching another episode of Black Mental Health Matters. Thank you so much, Sonia, for speaking to me again. It's such a pleasure being
so welcome
to you again. And I hope you guys all have a great day. So yeah, you guys have a good one. Bye.
Bye.